Hello, my friends. This is Dr. Diana as patient, and I am pretty ill. Today, I want to talk about something that most of us would rather hide. Fortunately, this chat does not involve constipation, diarrhea, or any bathroom habits this time. Now, I'm talking about how this illness can cause depression, bipolar presentation, anger, irritability, except with me. And loss of cognition. Okay, we fight it, we disguise it, we try to sleep through it, and at times we wallow in it, and for good reason. Who here is not justified in feeling depressed or irritable? Most of us are exhausted, we hurt, we've lost so much, and we have trouble finding doctors who are understanding of this condition and how it affects us. And by condition, I'm referring to our entire dysfunctional family here, okay? Ehlers-Danlos, POTS, MS, chronic fatigue, fibromyalgia, chronic Lyme, etc. But my friends, it is critical to know that much of this is due to brain chemistry that has gone wild and can be reversed. And amazingly, it can be reversed fairly quickly in most of us. Now, you know I carry the mast cell and cytokine flag for our conditions, right? I strongly encourage everyone listening to see if mast cells may be the cause of what we call organic brain disease. And folks, I have been there. And I will tell you what it was like when it got especially bad for me. You are talking to someone who knows, has experienced it, and has reversed it. It took about 2 weeks of medication, but I knew within 2 days it was helping. So, a miracle? No. Doctors have known about this for years, but because we tend to stick to our own specialties, this is an easy one to get lost in the mix, and doctors forget. Everyone is human after all, but I am here today to remind you, and you can gently remind your doctors about organic brain disease. I've got articles attached at prettyill.com after this video that you can take to them. Now, most importantly, do not be afraid to bring this up to a trusting doctor. If you can't find one, see if you can locate a psychiatrist who deals with chronic illness to help you get started. Mast cell specialists like Dr. Castells and Aikens in Boston are also great and can handle even the toughest mast cell disorders. Now, so what are the symptoms of organic brain disease? Bipolar presentation that comes and goes is very common. I always try to be objective with my symptoms in order to figure out what the heck is going on. When this started with me, I had episodes of feeling bipolar, and I was able to recognize that my reaction, good or bad, did not match the stimulus, but I couldn't control it. I had episodes of suicide ideation and depression that would start and stop as if someone turned on and off a light switch. Eventually, these episodes started to run together. This is very typical for mast cell disorders. We start out with episodes, but seem pretty normal in between those episodes. Now, as it progresses, however, we lose those great in-between times. I felt like the desire for suicide was justified, but sometimes I could tell it wasn't. I've dealt with lots of tough problems in the past, and it always seemed to maintain my strength and sense of humor, but I could see I was losing that strength, even though my illness didn't seem any worse, really. Does that make sense? The stimulus and the response didn't seem to line up. Now, irritability, I'd always been about the most patient person I knew. But when those episodes hit, I had a short fuse. The case studies you'll read about explain how many of these patients could feel this build up inside them and then explode, and then they kind of start at baseline again. Now, if this sounds like you, there's hope. Have a friend or a family member help you if you can't do it yourself, okay? It needs to be someone who will not judge you. When I read the article, Mixed Organic Brain Syndrome is a manifestation of systemic mastocytosis, I saw myself. You know to ask your doctors first, as I can't diagnose you or treat you through a video, right? But I was already suspecting mast cell disorders, so I grabbed over-the-counter Zantac and Zyrtec, double doses, and in 2 days, the cloud was lifting. In 2 weeks, I no longer had to avoid ledges or sharp instruments. It was unbelievable, really. Now, one of my best friends is a GI doctor who uses mast cell treatment as a first-line treatment for IBS, and he helped me get a mast cell stabilizer, cromolyn sodium in the States, ketotifen in Canada. Holy cow, what a difference. Now, as an eye doctor, we use mast cell stabilizers for the eyes when patients have those horrible allergy and dry eyes. Does that sound familiar to anyone? So I knew I needed to give it at least 2 to 6 weeks to have an effect. It basically doesn't kill your mast cells, but as the old ones die away, it keeps the new ones calm. It's a bit simplistic, but you kind of get the idea. You have to be religious about not missing a dose, as those little nasty mast cell boogers sneak in every chance they get. Oh, my IBS also went away in 2 days. It only returned when I got a little sloppy with the chrome lens. So now I decided not to just take the dosage protocol seriously. I decided to marry it, my friends, and I avoid histamine foods as much as I can as I await an appointment with a mast cell specialist. Now, my husband no longer has to wonder who will meet him at the door, Diana or her mean twin, Bipolar Diana. And our kids are on the same regimen. Family unity and love through pharmacy. You've got to love it. Now, my dear friends, please, please, please go to prettyill.com and look at the articles under this video. We are sick enough as it is. The least we can do is have some fun with it. And mast cells in your brain take away all the fun. Trust me on that. So, until next time, we are going to continue to change our worlds. One brain cell at a time if we have to. Gentle hugs to you all. Stop the show. You gotta tell me when we're starting here. One more time. Mast cell specialists like Dr. Castells and Akins in Baltimore are also great and can handle, I'm sorry, they're in Boston. Oh God, what, take 46 or something? Of my last time, okay.